What's good? God is good. I'm your host, Jay Did It. Welcome to Thursday Therapies, a podcast for all creatives, writers, rappers, poets, artists, activists, Sacramento Community Therapy Session. Today we have Moyo. Moyo is a board-certified psychiatric mental health nurse practitioner whose journey is a testament of resilience, purpose, and healing. After surviving a traumatic brain injury, developing epilepsy, battling depression and anxiety, and enduring the heartbreaking loss of his premature son, Moyo transformed some of life's most difficult experiences into a calling to help others. Since becoming a psych NP, he has dedicated his career to serving children, adolescents, adults, people of color, and gender diverse communities through compassionate and culturally competent care. Through his private practice, mentorship of future providers, and his platform, No Scrubs or White Coats, Moyo continues to make a difference by educating, empowering, and bringing awareness to mental health, one person, one provider, and one conversation at a time. Welcome, welcome, welcome to Thursday
Thank you, thank you, thank
Therapies.
you, thank you. That was mad.
Hey,
Yeah, thank you,
thank you
brother. Yeah,
so much for
yeah.
coming on. I'm so glad that we crossed paths.
Mhm.
I had the honor of hosting and interviewing you on your podcast, No Scrubs or White Coats,
Yes,
and
yes,
now
yes.
I'm having you on mine. I want to be able to
Mm.
spread your story, um, get a bigger view of who you are and what your story is and your background, and let the world know who you are. So
Oh,
thank you so much for coming on
you're
here.
welcome, welcome, welcome.
Yes,
Yeah.
yes, yes. So I'm going to ask some questions like we did
Okay,
on your
yes.
podcast and just go from there. Bring more awareness to mental health. Let everybody know who Moyo is and the
Uh-huh.
backstory behind your mission.
Yes.
Yes, yes, yes. So the early days before your traumatic brain injury changed your life, who was Moyo and what was it like growing up in Zimbabwe?
While growing up in Zimbabwe I grew up in a family with 12 kids, with 12 of us,
Wow,
one mother, one father. So we didn't know, we were poor, but we didn't know we were poor because we had a family.
that's right.
Yeah. Went to school, got an education, because in African parents, you got to go to school,
Yeah.
get educated. And no sports. Sports was not that big in Africa,
Mhm.
so education was the key to success.
S- So you finished school. When did you move here?
I moved
To
here to America in the year 2000.
2000.
Yes,
How old were you then?
I was 20, 21. I turned 21 that year. Yeah, I was born in 1978, so yeah, I turned 22 when I was a year.
Oh, okay. How did you like it? Big culture shock?
Oh, very big culture shock. Big culture shock. Because even homesickness, I didn't believe that homesickness was a thing.
Right,
Until I got here.
right.
When I got here, oh man, because I would dream of being at home
Yeah,
and then wake up in the middle of the night, I'm here.
yeah.
I was so disappointed. Every day,
Wow.
dreaming of being home.
Yeah,
Every day.
every day. So, how was it like growing up with so many siblings?
Well, my parents, my sister, the oldest, has a daughter older than me. So we took care of each other. I'm the second last born.
Mm.
So we took care of each other. And my parents, at some point, retired from work.
Oh, okay.
So the siblings had to chip in like most families do, African
Yeah,
families do.
yeah,
Like help each other out,
yeah.
pay school fees, tuition, keep each other, that kind of thing. Yeah.
That's right.
Yeah, so that's what we did.
That's right. Are you still close with your family?
Oh yeah, yeah, very close, very close. I speak to my family every day, almost.
I
Yeah,
love that.
every day.
That's amazing. That's a blessing. That's definitely a blessing.
Mm.
So, you said you were faking the funk and lacked direction. What did that season of your life look like when you were living in Oakland?
See what happened? I came to America on a scholarship.
Okay.
Shout out to Dr. Scott. He's passed now, rest in peace. He's a doctor from Oakland. So he saw me as working at a hotel, and we started conversation. Then he was like, I'd like to bring you to America to study.
Mm.
And I thought he was just kidding. Then later, I just kind of took him up on the offer. He brought me here to America.
Wow.
And then I was in school for like 2 years. Then I decided to do my own thing. Like
Yeah.
find a different path. And I was just lost.
You dropped out of school?
I dropped out of school, yeah.
What school were you going to?
I went to Laney
Okay.
in Oakland.
Okay.
Laney and, not Unlimited. Laney, most Laney, yeah.
Mm.
I was going to do computer science. But that was the year 2000. Then the bubble crashed. And then I just ended up just hanging out in the hood and just not doing.
Hanging out,
Well,
faking
yeah,
the funk.
yeah, that's
You was
what
just
that's
faking
what
the
it was.
funk
Yeah,
out
yeah,
there.
all the time.
No direction.
Yeah.
No direction. So looking back now, what do you think you were searching for during those years?
I think my purpose is searching for me.
Mm.
I was searching for my purpose. Yeah, because I tried a lot of things. I tried everything, but I just couldn't do it.
Yeah.
Once I found mental health, it was easy.
Yeah.
It was easy.
That was easy. So that's the turning point. The
Yeah,
turning
yeah.
point is take us back to October 30th, 2003. What happened and how did that night change the course of your life?
Well, so what happened was I was getting ready to go play shooting pool with my homeboys, and they live in North Oakland, so they decided to make a stop somewhere. If I stopped, that's when I got assaulted. I didn't even know that then. I woke up in the middle, like days later, in the ICU.
That's wild.
My hands tied.
That's
Mm.
wild. That's wild. So you just are chilling,
Yes.
getting ready to go out with your friends,
Yes.
play some pool, and then you end up in the ICU.
Yep. Yeah, in the ICU.
What happened?
I guess somebody, a group of folks just across me, just told me, just hit me on the head.
Were you by yourself?
Yes, I was by myself. I was gonna go. It was just a minute, a quick stop. I'm going to the pool place.
Mm.
So we made a quick stop, and then I forgot almost everything that happened that week.
Wow.
Things just came back later on,
Yeah.
piece by piece.
And people had to tell you what happened.
Yeah, yes. Then it was like little pieces of that just came into my head here and there. But it took a long time for me to kind of piece the whole story. Yeah.
Yeah. So you were in the ICU. Did they ever find out who did that?
Oh yeah, they found it. Yeah, I knew the guy, so it was.
You knew
some
the
silly
guy.
Group. Yeah, no, but I know.
You knew who he was.
Yeah, the person that hit me knows me.
What?
Yeah, but not in a friendly way. We just kind of know. Yeah.
You just knew of each other from the neighborhood.
Yes, yes.
Wow. It was just that's crazy.
Mm.
That's crazy.
Mm.
I'm sorry that happened to you. I'm really sorry that happened to you.
I'm sorry that happened too, but
wow. After spending 10 days in the ICU and nearly 2 months in rehab, what was your mindset during that recovery?
oh, I was so depressed.
Yeah.
Because once I got home from the hospital, I got home from the hospital, then I was just my body was a little bit okay. Then I started having seizures.
Yeah.
And the seizures were so I could have 3-4 seizures a day.
Wow.
Anytime. So imagine you can just have a seizure anytime. So it's like you always so anxious. I was so anxious all the time. Anxious, depressed, yeah.
Wow. And you were still early 20s.
Yeah, early 20s.
Early 20s. So
Yeah.
I mean your life is just barely starting. So and you're still going, your brain's not fully developed, and now you have a traumatic brain injury, and now you're having seizures, and then on top of that, sorry for your loss, you had another incident with your son.
Yeah, my son. Yeah, it was during that same period. That was like the hardest period of my life. Like the 2 years. Tough.
Wow.
Yeah.
Wow.
Epilepsy got hit, assaulted, ICU, rehab. Then got home, seizures. Then my wife was pregnant at the time. Got pregnant at the time. Her water burst early, so she gave birth prematurely.
Wow.
So I would walk to the hospital because my license was suspended too. Oh, that's another thing too.
They took your license away.
Yeah, because of the epilepsy. Yeah, the doctors reported that he's having seizures.
Wow.
So no license.
Wow.
I was every day, like every second, or every working moment, I was like, I might have a seizure any moment.
Wow. So what was how did you feel like mentally? How did you feel during that time?
It was draining, exhausting. Yeah.
Wow. And you just kept getting up.
Yeah, it was nothing else to do. I just kept getting up.
Wow.
So then my son was in the ICU for a few months, and they walked to the hospital to go see him.
Yeah.
Because they didn't have a license. The hospital, we live in North Oakland. He was in Ashby, Alta Base. It was like maybe 15-minute walk.
Yeah.
I'd walk there every day to see him.
Wow. That's tough. I mean, that's really tough.
Yeah, it was tough, yeah.
I'm sorry for your loss. Yeah, no, that's tough. It takes me back because I had a loss. I've carried my son full term also and lost him. Yeah, it's a horrific loss for sure.
Terrible.
Yeah. So how are you coping with that nowadays?
sometimes it kind of hits me hard, especially when I was preparing for the interview last week. Kind of like writing about it, like
Yeah.
kind of my eyes got tear, like because even that time I couldn't fully grieve because I was
Right.
going through
So
much stuff.
much.
Yeah,
Yeah.
so
Like
my body was just in survival mode. Yeah,
every day.
yeah.
Wow.
I just kept going and going and going and going. The grief was like no time for that.
Right.
Yeah.
Yeah, no, because it's like you said, survival mode, that'll push everything to the back, and you just, every day you got to try to
You just
survive
gotta
and fight.
keep yeah.
Keep
So I
fighting.
was just in the fight mode the whole
Yeah.
time. Yeah.
Wow. That's incredible. That's incredible. So where there was there a specific moment when you realized your life had been given a second chance, do you feel like?
I think yeah. When I was in the hospital, of course my mother cried so much. My mother, because my practice and pictures when I first woke up in the hospital. My brother, because my brother came to see me. When they came to see me, they just thought they were just going to come and pick up my body and take it home.
Wow.
That's how deep it was. That's how sick I was.
Oh my gosh.
And then, so on the pictures, I might show them later. My brother's sending me like he put like a handkerchief on my hand. I'm still in the ICU,
Mm.
and that's the handkerchief my mother used to wipe her tears.
Oh.
Yeah.
Wow, you held
Yeah.
on to that?
Yeah. No, she I don't know what she went to now, but it was I was in the hospital
Yeah.
in the bed,
Yeah.
still in a coma.
Wow.
My brother handed my handkerchief, put it in my hand. Yeah.
Mm.
And I guess that's the handkerchief my mother used to wipe her tears.
Yeah.
Even thinking about it now, like that's
Wow.
I got tear eyed just thinking about it because I hadn't said it to anyone before. But that's what happened to my brother when he came from Africa.
Did you know he did? You felt it?
No, they told me later on.
Oh,
So
okay.
then I saw it on the picture, like, oh, that's the handkerchief. Yeah.
Oh,
But I
wow.
knew the story that my mother brought my brother brought the handkerchief that my mother used.
Yeah.
Mm.
Oh, wow.
Yeah.
Oh,
Yeah,
that's
because I was dead, very dead. Yeah.
dang. I'm glad you pulled through there.
Yeah.
I'm glad you pulled through there. You're making big changes in the world
Yeah.
today, in the world. So, in early 2004, you developed epilepsy and experienced multiple seizures daily. What was that season like emotionally and mentally for you?
Yeah, it was because for a long time we tried about physician that I had then we tried all kinds of medications. So we were trying medications for epilepsy, and
Yeah.
it was not working. I was on like Dilantin, all kinds of things, just didn't work. And some of the medications made me sleepy.
Mm.
But then we finally found the medication that worked for me, and I was a little better.
Yeah.
But then disease would just happen too.
Yeah.
I couldn't be around smoke, like weed smoke. I couldn't be around it at all because the weeds. Because I know some people, weed makes disease go away.
Yeah.
For me, it was the opposite. If I
It
smelled
was
weed,
opposite.
yeah. If I smelled weed, that smoke would just trigger
Yeah.
epilepsy. Yeah.
So how did you get through that? And when would you don't suffer from it having seizures or epilepsy
No more. I don't know. No anymore.
occurrences?
No. It was for like a good 5 6 years.
Yeah.
Yeah, I was.
Wow.
And I was taking medication
The
for
whole
this.
time.
Yeah, the whole time. And every year, my doctor had to write to DMV to certify that I'm okay to drive.
Right.
But afterwards, it got better.
Oh, that's good.
Yeah.
As long as your brain was healing,
Yeah.
the better.
Mhm.
Oh, that's amazing. So, how did losing your independence, including having your driver's license suspended, affect your mental health?
Well, it's a loss. It's a loss because we see that even in all the adults that when they in the 80s or 90s they have to give up their driver's license.
Yeah.
So for me, I was a young kid,
Right.
young cat.
Right.
So that was devastating. I couldn't do nothing.
Right. It's like you're
And
losing your independence.
yes, and back then there was no Uber too. There was no
Right. Right.
yeah, no Lyft, no Uber. So you just
Well, you had the
stuck
BART.
stuck at home. Yeah,
I
yeah,
was stuck at home.
yeah, yeah.
Yeah.
But no one
Man.
wants to take the BART. Yeah,
No.
And you gotta walk to the part too.
Yeah, you got to walk there, catch it, and then walk to wherever your destination is,
Yeah,
and
so
then walk back, catch it, and then walk
yeah,
home.
it's a
Yeah.
full time
Oh,
job.
oh,
Yeah,
believe me, I
it's
know.
a full
Oh,
time
so
job. Yeah,
well.
yeah,
I done rode the RT around this town so many times,
yeah,
man, in the
yeah,
bus 23 and the bus 50 and the
yeah.
bus 82, and
And then the library, all that stuff.
man,
Yeah,
yeah, yeah. So, but it is. I mean, you got to do what you got to do. You got to pick
yep,
up and you got
yep.
to do what you
Mm,
got to do
mm.
if that's the case. But I'm glad that you have your license back and you're back up driving. What helped you keep moving forward while you felt overwhelmed during those times?
I think I was just in a fight mode.
Fight or flight.
Yeah, that's what I was just in a fight mode. Not even flight, just fight because, and no one ever said to me, "Quit, you can quit." No one ever remotely suggested it
Right.
because they had that would have taken their chance.
That's
I,
right.
I just kept going.
Kept going.
Yeah,
That's half the
yeah,
battle though. Like
yeah.
we talked about before,
Mm,
showing up is half the
mm.
battle. It's
I just
hard
kept
because
going.
you can get in your mind and
Yeah,
talk yourself out of doing things, but
mm,
as long as you just keep showing up every day, showing up for yourself
mm.
every day, that's half the battle.
That was not even an option. It wasn't even in my mind at all. It was like just. It wasn't even in the piece. No one. It was just not even in there. Yeah, so I just kept going.
Just kept going.
Mm,
That's right.
yeah.
That's strength. That's resilience. That's amazing. I love that. I love that. So, choosing a new path, you decided to return to school and become a nurse. What inspired that decision?
While being in the hospital for that time, that made me see, I gotta go back, into medicine
Yeah.
or nursing, yeah, because that's what saved me. Those are the people that saved me.
Yeah.
So I said, let me go back to school to be a nurse.
To be a nurse. Why not a
And
doctor?
I don't know, I just takes long, takes
Takes
long.
too long.
Yeah, and also I didn't have any role models. I was brought here by the doctor, but I didn't know other role models. I didn't know any doctors.
Okay.
Yeah, I knew some nurses. I knew they made money.
That's right.
Yeah, and it's quicker too. So I figured let me just go back to school.
Okay.
And I started from the bottom math, the early math, all the way to the top, because I was still healing too.
Yeah.
My brain was still not all the way healed.
Wow.
Yeah,
That's incredible.
I do speech therapy, physical therapy, occupational therapy, all that stuff. Yeah, basic questions that would just mess me up.
Yeah.
They'd ask me like, "What you do this morning?" I had no clue. What you had for breakfast? That'd be the hardest question ever.
Oh, wow.
Yeah, because my brain was still healing.
Yeah.
Yeah.
Wow. And you still ended up going to school
Yeah,
and challenging your brain,
yeah,
rewiring it.
yeah. That's what happened. Because just keep going to school.
Wow, that's amazing. It took you 6 years to complete 2-year nursing school degree. What kept you motivated through the setbacks?
I had another child too then, so I figured, I just gotta keep going for it. I had to provide.
That's right.
Yeah,
You had to provide, so
I had
you
to
had to make
provide.
it to
Yeah,
the end point.
so that's why even nursing was big because going to med school then is many more years of school. So this
Mm,
nursing is like not that far. You can see
right.
the light at the end tunnel like real quick.
Yeah.
Yeah,
Yeah, I get it. No, I get it. I did the same thing. That's when I started to go to school for human services and social work. You just keep showing up every day
yeah,
and then move on to the next and then move on to the next. But then
yeah.
life happens and you just got to
You
keep
just keep one
keep
foot
going.
and after the next. That's all.
Yeah. No,
You
that's
know,
a powerful story
mm,
because after suffering a traumatic brain injury and going back to school, I mean, some people could give up.
yeah,
Some people, can just throw in the towel and take a different route, and you decided not to.
yeah. I don't even know how I did it. It's just something. I just didn't quit. I don't know. It was. I didn't like intentionally not quit. It's not like I just was like I'm not quitting.
Do you think it stemmed from your background, from your family, from your
Probably,
parents?
probably,
Definitely,
probably.
like
Yeah,
with that
yeah.
resilience to
Yes.
continue to fight and
Mm.
and move forward.
And then education was the key in Africa. Education, because sports don't pay at all. We heard that people don't make money in sports.
Yeah,
So education was drilled into us.
yeah,
So I went back to school. Like this is what I'm gonna do.
yeah. That's amazing. That's so amazing. So, how did your own experiences as a patient influence the kind of healthcare provider that you wanted to become?
Uh what people do nowadays is that that's a good question. What people do that sometimes they just speak in these big terms.
Yeah,
and that confuses patients.
They don't understand. You leave more confused than when you showed up, definitely. And a lot of patients, it's hard for them to advocate for themselves.
No, you can't. You can't advocate for yourself because this guy is saying all this stuff. It's like Greek.
Right.
He's got a red coat on. It's intimidating.
It is very intimidating. And then you think because they're so educated that you know that they're what they say is factual about your life, but in reality, you're the CEO of your life, and you're the only one who knows what's going on inside of you.
Yes, because you're the expert in yourself.
Yes.
No, they may know, the doctors, nurses, whatever, they may know all about medication and treatment plans.
Right.
But you are the one that knows. You're the expert in your life.
That's right. That's right.
So I took that as that's why I always use simple terms to patients.
Right.
I want to break them down because that's how I understand things too.
Right.
If you break it down,
you got to break it down. Like that's a real human experience because you don't want to do any harm. You want to be able to let the patients know exactly what they're coming there for so that they can change to be better. And
also too, that makes you understand too, as a provider.
Right.
If you can say something like in a third grade level,
right.
If you say it over and over and over, they can understand it.
Right.
Because sometimes people use these big words that don't even know what they mean.
Right.
Because they've been told just use this word.
Yeah. Or what society says. Like a lot of people say people are bipolar or people have depression or people have OCD and they just use those terms so freely and not really knowing exact terms of it and saying, self-diagnosing and
that's sort of crazy because sometimes people be like, I've got OCD. Like, no.
Right.
You should want your space neat, okay?
Right.
That's not OCD, okay?
Right.
OCD is like, if I don't do this thing, if I don't take a shower 10 times, my dog will die.
Right.
That's OCD.
Yeah.
You just want your space neat. That's all.
Right.
Oh, sometimes the one I get the most, my ex-husband is a narcissist.
Yeah. Oh, that's a lot. A lot. I mean, sometimes men, sometimes people do have those tendencies, so they do use it so freely and loosely. Yes,
yeah,
I do
but
get
it's
that.
a criteria.
But it is. There is a certain
criteria
criteria for sure.
Just because he didn't agree with you.
That's why we got to get on here for those mental health moments, and we're gonna break it down. We'll break down the definition of a narcissist and let people know exactly what a narcissist is.
This bipolar thing, like, oh, he's bipolar. Like, no. Just use it like it's an insult.
It is. It can be for sure, definitely. So.
Oh, my ex-boyfriend was narcissist.
Right.
Because he didn't agree with you.
Right.
So who's the narcissist then?
We definitely have to have that mental health moment so that we can
we gotta break the term down.
Break it down for sure.
People just use terms as like cordials.
Right.
Weaponize the terms.
Definitely. Definitely. But it's important. That's the whole point of Thursday Therapies and bringing more awareness to mental health and educating people and having stories like your story that can encourage people to get to know what's going on with their mental health and get the right support they need for their mental health. For sure.
Because a lot of people, like people of color, they don't seek mental health.
Definitely not.
They don't.
No. But it's okay to seek help, and that's our message. It is okay to seek help for sure. If you don't like who you're working with, you always have the right to switch who you don't want to work with. Advocate for yourself. Advocacy for yourself means speaking up for yourself. If something ain't right, change it. You got to make the change. For sure.
And no one owns any patients. Anyone, you can take any services anywhere, wherever. You can just quit and go with someone else.
Right.
No, you need to explain yourself.
You don't have to explain it at all.
Nothing.
Definitely not. Definitely not. So, what drew you specifically to psychiatric nursing and eventually becoming a psychiatric nurse practitioner?
I think psychiatric nursing, we touched on this before, but I will touch on it again. It chose me. Because remember, like, when I was in the nursing program, you have to go to the hospital to see patients. The first semester, you don't do anything. You say, just sit here and keep them coming. Just talk to them. You don't even do nothing. Next semester, maybe do vitals. So I was just sit there with people. My first patient lady, black lady, she started talking to me, telling me some secrets that she didn't even tell the kids, her doctor.
Wow. Yeah.
I was like, wow.
That's right.
And she just started crying too.
Mm.
And she was talking to me. And I'm just thinking, if my instructor walks in, she
Oh
will be
no.
like, you out of school. You out of school.
Oh
Me started
wow.
to cry, yeah? That happened a few other times. So like, you know what, I didn't know how to respond. I really didn't.
Right.
I didn't know what to say. So I just started reading about how you can active listening. Yeah.
So you started reading up on active listening before you even knew that you were going to become
Yes.
a psychiatric
Because
nurse.
what I knew in my head I was going to be like a cardiac nurse.
Mm-hmm.
I knew in my head I was going to be a cardiac nurse.
Yeah.
I knew it.
You just knew it.
Yeah. But
God had other plans.
yeah, that just all went away.
That's right.
I already had a name for my practice too.
Did you?
Yeah. That one, yeah.
You don't want to say it out loud.
No, the name is, my last name is Moyo. Moyo means heart or soul.
Oh, okay. That's right.
So it could be like Moyo, heart tender, something like that.
Okay.
Yeah.
All right.
But then it just didn't work out that way.
That's right, though. You still wear your heart on your sleeve, and you there for people in a different way, and it definitely matters. Mental health matters for sure, for sure. So, as someone who has experienced depression, anxiety, trauma, and grief, how has that shaped the way you care for patients?
I want to be present for them.
Be present, 100%.
Yeah, because people want to be heard.
Yeah,
people want to know you are there for them.
that's right.
And they can spot you. So most of our patients, they've been on the block.
Yeah.
They've started to help everywhere else too.
Right.
So they can just see, this Negro's full of shit.
Yeah, they bullshit me. Yeah.
So they can see it.
That's true, though. That is so true. And that's why, I mean, a lot of people don't trust, because sometimes they have the bad experience, the first impression, they don't, to build a rapport. They never get past that building rapport because they have such a bad impression.
And so it's like an art and a science to it too. The way your office looks, the way you show up,
right?
You present yourself too,
right? Absolutely,
that sends a message.
Definitely,
because people make a judgment within less than a second.
Right.
So once they make that judgment, it's hard to like make a second impression.
It definitely is. Yeah, and that's a learned skill. That's something that you don't just get overnight.
No.
Because but some people you have the heart, and you, like you said, mental health found you. I feel like it's the same thing with me. I have a lot of lived experience. Also, and for me, I wanted to study and understand what my why was I so dysfunctional? Why was my family dysfunctional? I wanted to know what was wrong with me and what was going on with me. So mental health found me through my dysfunction.
Yes, but then you have to study too. Because there are a lot of people that dysfunctional in this world anyway, unfortunately.
Right.
But if it finds you, then you got to do something about it.
That's what I'm saying. Right. Yeah. I needed to know to know what depression was. I needed to know what anxiety was. I needed to know what what all those different bipolar, or what any of that, schizophrenic. I needed to know what that was, because I needed to know, why am I feeling this in my body? Why? Because they tried to prescribe me with Prozac at the age of 12, and my mom was like, "We're not giving you that. You're not taking those medications." And I had to go to counseling and do a bunch of other things, and that's when I was first introduced to and really knew. At the time, like, it really didn't click and register with me what was going on, because back then it's like, what happens in the house stays in the house, and I'm not putting my kids on those medications. And, my mom was in denial, bless her heart. I love her, and she really didn't get the help she needed for her mental health. And I didn't really, until like I said, after I moved out of the home and needed to know what was going on with me and why I was feeling that way.
Most of us, like black folks, that's unfortunate, because most of us are in such survival mode. Right. Our parents are in survival mode.
That's it.
In the fight mode.
Right.
They have no time for feelings.
They don't.
So when we say depression, anxiety, they're like, what?
Right. Yeah. Right. No, we just, they, like you said, they're in survival mode. They do the best they can. Like my mom, she did the best she can. She did with what she knew. And for me, I'm like, I need to break that cycle. I need to figure out what that feeling is inside of my body, because I know I see people that are getting help and carrying on in life and going about their life every day. Why can't I do that? Why do I keep going back to the same stuff? So I got to make a change.
It's the same with me. Like, I think if I was, like, I was born in Africa, so like if I was maybe born over here of different parents, I'd have been diagnosed with ADHD as a kid.
Right.
I would have been, but you just tell you're lazy, you can't
Right.
work. Yeah, yeah,
Yeah.
slow. Yeah,
Definitely. Definitely.
change. Yeah,
Yeah. And that's another thing
Yeah.
though, is because a lot of people, that's how a lot of people end up self-medicating with
Yeah.
substance use, is because they do go undiagnosed.
yeah. And then they have to medicate themselves because it makes them feel good. Huh?
Right.
Yeah.
Definitely to numb the pain
Yeah.
of whatever.
Mm.
Definitely. So you built your private practice from the ground up. What has been the most rewarding part of serving your community?
And the fact that I can see people on my own terms.
That's right.
I can. First of all, I don't have the code switch.
I love that.
I don't have the code switch.
Yeah.
That's number one. Number two, I can meet people where they are.
Yeah.
I have no time limit. Of course, I need to sometimes make time to do things, but I can, because when you work for someone, they say see four people an hour.
Right.
That's too much.
Yeah.
4 people an hour.
Back to back to back. That's a lot. You're taking in a lot. You're taking a lot. Like, that's a lot of people's energy. And sometimes it's sad, sometimes it's mad, sometimes it's happy. You just never know. That's like up and down, and that's taken from you.
Yes, and also if someone started to open up to you, time's up.
Right.
You gotta go.
Right.
They're not happy.
Right.
You're not happy. So it's like, but if you work with yourself, like work for myself, so I can, my appointment is like intake at 1 hour.
Yeah.
My follow-up is 45 minutes, but sometimes it can go to up to an hour.
Yeah.
Because I want time to be
give that extra time. Yeah.
Because people want to be spoken to.
Right. They want to be heard.
They want to be heard. Yeah.
Yeah, for sure.
Because sometimes I have people that come to me like, my doctor. They come to me for a second opinion because the doctor diagnosed them within 5 minutes.
Wow. That's impossible. I don't know.
But sometimes it's the right diagnosis.
That's crazy.
But people want that time.
Yeah.
The people are stuck on that. They spend enough time with me. Sometimes these doctors have been doing this thing forever.
Yeah.
So they just know it. So they just diagnose it.
It's sometimes the doctors, I mean, because they are overpopulated, and a lot of times they could be burnt out.
They're burnt out too, because even them too, like they work for those big hospitals.
Right.
They have to see people like
back to back, without a break. And if you're not taking care of yourself outside of home, it's hard to get that balance. Burnout is a real thing.
So the patient's not happy, you're not happy. So what are we doing here?
Right. Yeah. We got to make a change.
So that's why I see patients 1 hour.
Right. We got to go to Better Days Consultant. You hear that, y'all? Better Days Consultant. Please. Check yourself, check your mental health at Better Days Consultant. I love that. I love that. No, but that's real. Like, meet people where they're at. You got to meet them where you're at. But at the same time, you can't really pour into people if your cup is empty. So what do you do for self-care?
I spoil myself now. I used to feel guilty. I used to feel guilty.
Spoil yourself. I can tell.
I used to feel guilty for come from Africa.
Yeah.
Like you gotta do for everyone else.
Right.
Because even most families, like, you gotta do for everyone else.
Yeah.
But to do for someone yourself,
you gotta take care of yourself.
But now I spoil myself.
Yeah. Did you learn that through your programs? Self-care.
You have to. Somehow you can figure it out.
Yeah.
You figure it out.
Yeah.
The books tell you that too, but to practice is something different.
Yeah. So what are some things you do for self-care?
Go on vacation.
I love that.
Yeah. Go see shows. I just came from seeing Buju Banton and Jamie Stephen Marley in Oakland.
Nice.
So I take time for myself.
I love that.
Because my patients deserve someone. I do it from my patients.
That's right. Yeah. You do it for your patients.
Yes.
That's right. You go out there and you go out there to the concerts for your patients. I love that.
They need someone that's well.
It's true. Yeah. It's real. No, because you got to do the things you like, because you're going to start resenting what you're doing if you don't do the things you like. You're going to get burnt out.
Yeah.
Definitely. You got to find that balance.
You got to, otherwise you can't change yourself.
Right.
Because when you work hard, you got to play hard too.
You got to work hard, play hard. I love that.
And some people say love hard too. Like, I don't know about that, but Work hard, play hard. Yeah.
Work hard, play hard. Yeah, of
Yeah.
course. Love hard. The right person.
Yeah.
The right.
That gets tricky there, but
It gets
work hard.
tricky.
Yeah. Yeah.
Yes, definitely for sure. But that's for another episode.
Yeah.
Paying it forward. So, you precept psych NP students and train new providers. Why is mentorship so important to you? Why is it so important to you?
Because we need more providers.
Yes.
And because psych NPs, like what happened was because physicians takes forever, like 8-10 years.
Yeah.
To be in the market. So the powers that be, whoever, government, whoever, figure let's create NP programs. The way people can train and can be ready for practice in half the time.
Yeah.
Or less than half the time.
Yeah.
So that's what the second program were brought up.
More hands-on.
Yeah, it's more hands-on.
I like that.
And so what happens is sometimes people, of course, the schools, they do a very good job of helping you pass.
Yeah. Pass the book.
Yeah.
Through the book, yeah.
They help you pass the boards.
Yeah.
Afterwards, you're on your own. The employer thinks you're ready for practice.
Right.
You're not ready, so you're anxious. Yeah.
Yeah, no, it is tough.
So that's
you're dealing with real life people.
Yeah,
and you're in their lives. So it's just like whatever is on the book, you don't have too much hands on.
Yeah.
So that's what you do, your mentorship. How long is your mentorship program?
It depends, because I've got students that I just graduated from school. Some of them are in the program. Like Yale, all kinds of schools, Yale, many schools. So they come to my office for the residency. Oh, I say residency, but preceptorship.
Yeah.
They come and then I teach them, and I don't do. Some people, the students come and they just don't do hands on. It's like they say the patient with me the first time. Next 2 times, they're on their own. Okay. I'm there.
Yeah.
I'm watching, observing.
Yeah.
Because people don't get to do it.
Yeah.
Then they graduate, they don't know how to talk to people.
Yeah.
Yeah.
Yeah, no, that's a good mentorship program. I mean, because I like the way, like, just based off of how you say you like to meet the patient where they are, and you have to meet them where they're at, or else it's a recipe for disaster.
And the students too, like, it's just like anything. You can watch videos about swimming,
right?
Or watch movies about swimming, but if you want to learn swimming, you gotta swim.
You got to.
You got to get in the pool.
Definitely.
So I throw them in the pool.
That's right.
I'm there. I throw them in the pool.
You're right there. You got a life jacket.
Yeah.
You got the little floaty.
That's the only way to learn.
That's right.
Yeah.
That's right. We need more people like you. We need more programs like you, because like you said, like we talked about earlier, a lot of these practitioners, a lot of the doctors, a lot of the therapists, a lot of them social workers are burnt out because it's just what's going on in the world right now is tough and it's hard. I mean, on a lot of people's mental health, and we just need more help. We definitely need more help out there, and we need more seasoned help, people who have more experience, hands-on experience.
And the way to get the seasoned help is to do it over.
Right.
Absolutely. The first few times you're gonna suck.
Right.
You're gonna suck.
Yeah.
But just keep doing it.
Right.
Keep doing it. Keep showing up.
And that's okay. You might suck too, but that's just like any other therapist. Everybody ain't for everybody. So some people might not like you. You might not click with everybody else. Then you just keep trying and you keep practicing, because that's the human experience. We all aren't gonna like each other. We all don't like each other. People have their preferences, and that's okay.
Yeah.
And then you just got to find your groove and continue to do no harm.
And that's the trick is to get someone to show up for next appointment.
That's right.
That's the trick. Most people will show up.
Right. And that's based off of building rapport. That's that first impression.
You gotta show up like in a way and so don't act like a know-it-all.
Right.
Don't use big terms.
Yeah, no. Please don't.
Yeah. And then it'll show up next time.
That's
the bias are low.
Yeah.
But that's what you do.
That's all right. And because you work with kids too. So how are they going to understand all that? I mean, of course the kids aren't going to understand. The adults don't understand a lot of that stuff, but definitely the kids aren't going to understand it.
Yes. And the kid with the kids too. Their parents gotta like you.
Yeah. The parents gotta like you for sure.
Because if the parents don't like you,
right,
you're never gonna see that kid again.
Definitely. Yeah. And you gotta educate the parents also.
Yeah.
For sure.
If the parents don't click with you, nah. You can have someone on the kids.
Right.
But if the parents don't like you, nah, it's over.
Yeah. Yeah. So, what gaps do you see between students who learn in the school and what they experience and in real world experience?
Well, school just teaches you like it's like every diagnosis is like is everyone takes all the boxes.
Right.
Everything is just like in a bowl. It's like rubbed up with a bowl.
Right.
Real life is not like that. So when you get out there and you see someone that maybe they got bipolar,
Yeah.
bipolar 1 or 2, the book says they have to have this, and that. Then if that person doesn't have that, oh, they're not bipolar.
Mm.
They say, oh, maybe they're anxious. They something else. So the key is just to listen to folks.
Right.
People let you know what's going on with them.
Right.
When you listen to folks who don't listen, don't diagnose them. Just listen.
Just listen.
Yeah.
That's right.
It's easier said than done.
Oh yeah.
I do it too. I felt it too.
Yeah.
Just listen. And it's because sometimes you jump in and you provide a new provider. You want to show them that you know something.
Right.
So they say something, then you jump in.
Yeah.
Jump in. So you keep jumping in.
Right.
Interrupt the flow. Which is that the session becomes longer and longer.
Yeah. So, so yours is Better Days Consulting, and you cater to a wide variety of patients.
So Better Days Consulting is the for the students.
Okay.
The clinics Better Days Psychiatric.
Better Days Psychiatric.
Psychiatric nursing. Yeah.
Okay.
So I see kids, adults, like all kinds of folks, people of color, transgender folks, gay
Right.
folks. Yeah.
Why is it so important for you to have such a diverse population in your agency?
Because everyone needs care. Everyone needs to be respected.
That's right.
People are suffering.
Yeah.
Some people suffer in silence.
So a lot of people are suffering
a lot of
in
people,
silence.
Yeah. You don't have to. You don't
Right.
have to. I have the patients when I prescribe medication for them. Then they call me like a few days, like, "Oh, that medication is working."
Oh, okay.
Yeah, it is working. Yeah, it's supposed to.
Right.
You don't have to suffer in silence. Okay, you don't have to.
That's right.
Especially us black folks, we suffer in silence all the time.
Yeah.
Because the parents say, "Oh, you don't. You can, if you have any problems, just pray. Go pray."
Just pray about it. That's so true.
And your homie's like, "Oh, he crazy." So like, what do you do? Yeah,
Right.
yeah. So people end up just smoking weed, medicating,
Yeah.
drinking too much alcohol.
Yeah. And then causing more problems,
Yeah,
and
more
then
problems, yeah.
and then bringing on more mental health problems. You
Yes.
know, and that's that vicious cycle that we're trying to break.
Or some people might hear voices, and then you just start medicating them with, I don't know, meth, whatever.
Right.
So now you don't know what's going on. What came first?
Yeah.
The voices of the meth.
Right.
Yeah.
That's another one, and it's hard too because I mean, a lot of people are a lot of things nowadays is the marijuana is causing psychosis, also because of the potency.
Yeah. Oh yeah.
Of it.
Yeah. It's caused psychosis. It causes all kinds of things, problems.
Right.
Anxiety too.
Yeah.
But people don't like hear that. Especially black folks. I always preface this when I talking about black patients. I'm like, some of them they smoke weed. I'm like, you know what? I'm not going to tell you to quit, because they're not going to quit.
Right.
If you say quit weed, you're not going to see them again.
Right.
They just go away.
Yeah.
I tell them, but weed, I say you smoke weed, but weed does cause anxiety.
It definitely does.
It does.
For sure.
You do what you do, but I'm letting you know, that causes anxiety.
Yeah. That is so true. Weed causes anxiety. So be mindful of what you decide
if you say that,
to do.
no, not the sativa.
Right.
Not
the indica.
Not the indica. Yeah.
Right.
Yeah. Oh yeah. I always got an excuse. So I'm like, nah. Okay.
Right.
Yeah.
Be
so
mindful.
I used to be like, so now just tell me, weed causes. That's it.
Right.
And move on.
Yeah.
Because if you try to act like you gotta stop smoking weed.
Yeah.
You know what I'm saying?
Well, it's up to the person. It's
Yeah.
always up to the person. I mean, and a lot of people like weed. It does help. It does help them.
Yeah.
With different things, and it can help their mood. But some people, it's a trigger, and it can make it definitely worse.
Just like I was saying, some people use it to cure epilepsy.
Right.
Yeah. But with me, this weed make
separate
trigger my epilepsy.
Yeah.
So I had to quit smoking weed years ago.
Yeah.
That,
So that's a good thing.
Yeah, it is, yeah. And it's because good thing.
Yeah.
Good thing.
Through Better Days
Like,
Consultant and No Scrubs or White Coats, what changes are you hoping to create within the mental health profession?
I want to spread my message because now what happens, I can only take like 3 or 4 students in my office at a time.
Okay.
4 is the maximum. I really don't take 4, like 3. So I can only teach 3 people, maybe 12 people a year.
Okay.
But if with the platform, I can reach out to more folks.
That's right.
Yeah.
I love that.
Yeah. Reach out to more folks. Yeah, because it's a lot of students like me. They were not students that were anxious.
Right.
To know what to do.
Yeah.
Yeah.
That's right.
To know how to practice. But the boss like, hey, you got 10 patients tomorrow. You got 20 patients tomorrow.
Right.
You got to show up.
You got to show
People
up.
are just like, anxious. Because the boss thinks they know what they're doing.
Right. That can be
Then, yeah,
scary.
it's
That
scary,
can be
it's
really scary because you're
Scary.
working in these people's lives. This, it's
Scary.
hard.
And then
Mental
to
health
admit to
field
yourself
is
to like, I don't know.
right.
And then to admit to someone else, I don't know. Yeah.
Right.
So this is from someone that's been there.
That's right.
I've been there. So I know I've been in these people's shoes.
I love that.
Yeah.
Yeah. Keep it up too. Yeah. So your reach is going to get a lot further. People are going to get the help they need. I definitely hope that it grows to be really big and just bring more awareness to mental health.
Yeah, yeah.
Educate people on mental health. Let people know that it's okay to get help.
Yeah.
It's okay to advocate for yourself. Don't be afraid, and just know that if something ain't working out for you, you could always switch.
Yeah, yeah. People, you don't have to tell them why. You just can just switch.
Just switch.
Because you're wasting your time.
You're
wasting your time. Yeah?
Right. Definitely. But get help.
Yeah.
If you're suffering with the mental health issue and
Get
silence and
help is there. Help is there.
it's there. Definitely. It definitely is there. I appreciate it.
Go get it, yeah.
Yes.
There's someone out there. You'll find your tribe.
Yes.
I tell people all the time, your tribe is out there.
It is.
Someone out there for you.
You got that right. It is true. It is true. So when people look back on your life and career, what do you hope that they remember most about Moyo and the impact you made?
That I provided value for everyone, for people.
Value. That's right.
For a lot of people. That's why I take insurance, because I know some people want to do this case-based practices.
Right.
If you do a case-based practice, then you kind of pricing out other people.
Yeah.
Many people have no money.
Right.
I accept people with Medicare, Medi-Health, all kinds of insurances.
Yeah.
Except Kaiser.
Yeah.
Kaiser and Blue Shield, but I take over all the insurances. But now the new phase, let's just case-based. For what?
Yeah.
I want to serve as most.
Everybody needs help.
I want to serve the most amount of people I can.
Right. That's right.
Because all the case-based is just excluding other people.
It definitely is. It definitely.
And the people that can afford it have insurance.
Right.
So they'll use the insurance.
Right.
So case-based is like, you can never sustain their lifestyle.
Yeah.
You won't even be able to serve as many people as you can.
Right. That's right. You want to give the most tools to as many people as you can, and that's why it's great to have these platforms too, is to reach people, to reach as many people as you can, to let them know that the help is out there, like you said.
Because like if you try to do a case based, that's almost like gatekeeping too.
Yeah, you're right.
Yeah, it's
that
gatekeeping.
is gatekeeping for sure.
Because no one can afford it. Most people can afford it.
No. Yeah. And especially here in California, I mean, everything is expensive.
Yes.
Everything is expensive. So
in California, to take a day off is expensive.
To take a day off is expensive. You got that right.
So,
no days off. That's right.
So you can't gatekeep.
Right. Well, I appreciate you. I appreciate you for coming on Thursday Therapies. I appreciate you. Your story is very powerful. I want to hear more of it and hope to continue to work with you in the future. Yeah. Where can people find you? What is your websites?
Better Day Psychiatric and Nursing Inc. Is where, even in Psychology Today, you can go to Psychology Today for patients. I'm there.
Okay. But for patients, just like you said, you got to meet them where they're at. A lot of our patients and a lot of our listeners aren't going to be on Psychology Today.
Yeah, but there's one. So
Better Days Consultant and Better Days Psychiatric
Nursing. Yeah,
Nursing.
Better Days Psychiatric Nursing.
Yes, that's right. Yeah. That's right. And you have an Instagram also.
Yeah, I don't know how to use it. I do have. I wouldn't know the handle.
People want to find you.
Yeah, I do have Instagram. I think it's Better Days 26. Yeah.
Okay.
Yeah, something. Yeah.
And look out look out for the podcast. No Scrubs or White Coats. Bringing more awareness to mental health.
Yep.
Thank you so much. Thank you so much. Stay grounded and rooted in mental health. Check yourself. Check your mental health.